Aortic valve stenosis is a condition that occurs when the opening of the heart aortic valve becomes narrow, reducing or blocking blood flow from the heart into the main artery of the body, and over time will eventually lead to heart failure. Hi, I'm Shaiful Azmi, and in today's Heart News, we will take a look at Myval, a heart valve that is made using biological tissue, designed to be a solution to treat patients with aortic valve stenosis. Traditionally, patients with severe aortic valve stenosis will be advised to undergo open heart surgery to replace the valve. However, 30% of the patients are unable to go through this procedure because of the risk that it has on underlying medical conditions and age. As an alternative, a transcatheter aortic valve implantation, or TAVI, would be recommended. TAVI procedure is relatively new. Minimally invasive procedure performed by way of inserting a catheter into an artery at the upper thigh, which then allows the replacement valve to be guided up the aortic valve without opening the chest or heart. It causes lesser trauma, if any, and quicker recovery time as compared to an open heart surgery. After the procedure, most of the patients can be discharged within 2 to 3 days and will be able to go back to their normal routine.
The main cause of severe aortic stenosis is degenerative, meaning that it happens in the very elderly person. After so many years of life, the valve becomes degenerated. That's the reason why they get narrowed. Generally, the procedure is quite simple and quite straightforward, but it all depends on the patient's condition. Sometimes, if they have certain conditions like heart failure, like very poor access, the arteries are very small, patient with end-stage renal disease, it might be a contraindication to the procedure.
As a new addition to IJN's existing capabilities, Myval enables doctors to carry out the TAVI procedure with even greater precision. Myval, a balloon expandable transcatheter aortic valve replacement, has a unique hybrid honeycomb cell design concept, with open cells on the upper half to ensure unjailing of the coronary ostia. The valve has a bovine pericardium tri-leaflet valve, heart pouch harvested from juvenile cow, and can minimize paravalvular leak, and has a sealing cuff that allows it to improve resistance to puncture. It has shown a 97% success rate with a very low device-related mortality. The first patient to receive the Myval from IJN was an 84-year-old patient with severe aortic stenosis, who was previously experiencing shortness of breath and chest pain due to her condition. The procedure was carried out by Dr. Shaiful Azmi on the 31st of December 2020.
Many years ago, everybody will be going for valve surgery. But valve surgery in the elderly are not without risk, because the patient needs to go under general anesthesia, have to have an open chest, and the heart needs to be stopped and be on pump. By itself poses danger and risk for the patient. Now, the valve is specially made for stenotic valve only. In our case, it's severe aortic stenosis. But this valve has been also tried upon other areas like a valve-in-valve. We can implant this Myval in those surgical valve. So that is the advantage of this percutaneous method, where we can deploy them at other places other than the aortic valve itself.
IJN has been a pioneer of TAVI regionally, being the first center in Asia to introduce the procedure. Since 2009, IJN has successfully carried out TAVI with a multidisciplinary team comprising of cardiologists, cardiothoracic surgeon, anesthetist, and paramedical staff. With that, we end today's Heart News. I'm Shaiful Azmi. Thank you for watching. Stay safe and don't forget to subscribe.